presented this project here. We were that they were here before they first went to ATO zone. Now they will talk about results of the first operation mission of the ATO zone of the first mobile volunteer hospital. I would like to invite Hennadiy Druzenko, Oleksandr Lynchevskyi, and Tetiana Veselik.
O, same tak.
Esteemed colleagues, it's nice seeing you all here after we got back. I will start from the main result of our mission. We are proud that 26 people went there and 26 came back. And that is absolutely the correct approach, because the most important thing we have in Ukraine is people, golden people. But in Ukraine, we have a very big concentration of these good golden people too. So for you to understand how this mission was going on, I would like to ask the guys to show the video. 1+1 channel was there. In the east, there's the lack of doctors. The first voluntary mobile hospital was sent there. The doctors joined it voluntarily. Now they travel from Piski to Volnovakha, and now we will show how much work the volunteer medical doctors have. The local people were saying the Ukrainian army is getting ready for full-scale offense. We are covering the most problematic section from Volnovakha to Piski, and that means that the doctors have work all the time. The first surgery was in the ambulance. The sense of the hospital is to provide the correct type of assistance at right time, and that's the main slogan of the military medicine. The doctors who worked at Maidan during the Revolution of Dignity first raised the resources and then got together the team, and they started working almost in conditions of the battlefield. In the pre-front zone, they are absolutely autonomous. Any regional hospital could envy this storage of medicines, the stock of medicines. You don't need any film, anything. There are lines of servicemen who want doctors to see them. I have a problem in the neck. Oksana, who's a therapist, receives the militants, and their problems are the colds and other things. The local hospital provides with beds, but I could not believe that that is an operating and acting hospital. Paramedicals who are part of the mobile hospital use any interval to demonstrate some simple actions to military which will help to save life. Paramedicals, they're trying to give their knowledge during 4 hours. Some servicemen very often say that, well, the people cannot render assistance to themselves, but in a few hours the medical doctors convince them that they need to know what could be done to save lives of people, because 60 from 100 die because they cannot stop bleeding. After a very difficult day, they go back to this hospital. But they call these walls installation. You can believe that these are bad conditions, or you can say that that's some underground installation. Instead of them, other medical doctors will arrive. There will be the rotation, and there are many of the doctors who are ready to replace the medical doctors in the ATO zone. And the next one is here. You've seen how we worked in the East. Oleksandr Lynchevskyi is the chief doctor who will tell about the medical results of our 10-day mission. But we were covering several sections. We can say that the hospital was based in Kurakhova on the highway Zaporizhzhia-Donetsk, about 40 kilometers away from Donetsk. We were covering from Volnovakha to Pisky and the northern part. The main problem is psychological, because the soldiers who are in the fields, they do not understand why they are there. And because in reality, when there's no clear political position, whether we are offending, withdrawing, it's very difficult to motivate people who were taken away from wife, from children, and who were thrown into this unknown situation. First, what we were working with, we were examining them. It would be good if the fourth wave of mobilization could analyze the mistakes of the previous wave, because we would find some people who had TB or HIV. So basically, those who are sent to the front line are to be selected carefully. Also, why we prepared this mobile hospital was to treat the wounded people.
He fragments in his leg. We saw a report. There was one more soldier who was wounded at the checkpoint, and thank God he survived. The bullet went through his cheeks, but didn't touch anything important. So, second point, it's classical operation, surgery with the wounded, and the weakest direction is timely evacuation. Critically, we don't have enough of transportation means, and others are used, and they're not equipped, and that are easy. That are not armored, and the wounded soldiers don't reach doctors, and that's a big issue. And one more, a strategic mission is that we started to finally we overcome that coldness between local people and us, and they are they go to different hospitals, local people in different hospitals, and we have several times less doctors than it was supposed to be, and so there's a big problem with healthcare. So our intervention, when we have 50-50, have military, some have civilians, we were that thaw that started to break distrust among local people to the government in Kiev. We returned. It was the first mission. It was the intelligence through the battle. We will take into consideration the problems, and then in January we'll start a rotation, non-stop rotation, depending on where the situation will need our hospital, as experience shows, and we covered the Sector B with the help of military doctors. One field hospital, is in the north of Luhansk region, and the other one is near Mariupol, and there is a great distance between them that is not covered with military hospitals. And I would like to thank all, without whom our mission would be impossible. You listen to the representative of strategic partners, Cooperations for Rock and Foundation to Strengthen Communities, Tetiana Vasilak, who sacrificed their New Year corporate party to help our hospital. Unfortunately, our person, advisor of the head of Dnipropetrovsk Oblast Administration, Tatiana Hupa, is not with us, and chief of medical staff, Mr. Kush, and we cooperate with that. And we know now how to enroll civilian doctors to ATO and all hybrid war. Now I'm happy to give the floor to the person whom you saw in the video, Oleksandr Lynchevskyi. He will report on medical results of our first medical mission.
Good afternoon. Probably I would not be talking about medical results. To expect some figures and statistical information is probably not a big sense. To communicate, to talk to mobile hospital about the results of their work, it's like you are talking with some fire extinguishers about the results of their work. If there's no fire, there's no work. Is that true? Of course, we were ready to this type of work. The hospital was designed and is functioning to work with the trauma wounds in the warfare. And now, well, basically with the wounded people who we had, we managed to cope. So the numbers are not so important. What is important is that the hospital was organized and is a full-fledged functioning hospital. It is there and it does what it is designed to do. And now, together with our donors, we have a small model of tactical medicine. This training of servicemen, we are training them in first aid, in providing first aid. Also, we are teaching military paramedicals who are providing assistance to wounded when there's no doctor. And that is also the first mobile hospital. It's basically a team of surgeons that is providing some medical assistance, and that is how it's happening in civilized countries. And this is a small model starting from a field, a serviceman first gets to this field hospital, then mobile hospital, and then to a regular military hospital. So please ask please tell us how many servicemen were taught. I am the medical director of the initiative of the World Congress of Ukrainians Patriot Defense. And just this organization taught more than 11,000 military. These are the courses, some of them in the ATO zone, others are somewhere in the test fields, and also we are providing the NATO-type medical first aid kits. But also I know that there are many good people, many medical volunteers who are doing the same, and I don't know about how many they've done, how much they've done. The hospital which is there, basically we see who needs our assistance. Military people say where there will be rotation so that it doesn't happen like it was in June when we are working hard with some unit and then this unit is in Kiev for 2 more months and another part of the same unit goes to ATO zone. When the hospital is there, we can find common understanding with the military commandership, and we can provide assistance to those who need assistance. I will reveal some secret. I have some statistical information. 159 patients we had within 10 days. What you've seen in this video, That is this battalion of a special purpose battalion, which Oleksandr was teaching. Basically, next day they went to the airport, and we would like to thank Uliana from Patriot Defense. We managed, thanks to that, not just to train them, but also to quickly give them the first aid kits, and that means that we don't need any single signature, but it's just based on personal context. The war is a resource. You can be hero, you can be patriot, you can be whatever. Unfortunately, when you don't know bullets, you don't know uniform, fuel, equipment, you lose in modern war. And that is why we are grateful to one of the captains of agricultural industry who supported us not just as the volunteers, but they gave us money which they were planning to spend for their corporate celebration of the New Year Eve, and Tatiana Vasilik will tell you more. Good afternoon. It is important, it is needed to get united around the problems which Ukraine faces, and hundreds, thousands of small and big volunteer initiatives support Ukrainian people, support Ukrainian army. We joined the mission of support and the charity fund in cooperation with the Svarog Group Corporation accumulated 4 million hryvnias, and we donated them to support people to procure the helmets, the armored vests, and to do many more important things for them. And we were proud to support the initiative on creating this mobile hospital, because we are sure that the life and health are to be protected and they require a lot of attention. And that was the joint decision of a big corporation of 5,000 people to donate 50,000 hryvnias. The hospital will continue to provide assistance to population, to military in treating and in prevention of diseases. We would like the military actions to stop so that we have peace, well-being in our land, and so that the hospital continues to provide services to peaceful population. Thank you.
До Тетяни, мабуть, питання там буде.
The questions, will there be the second, the third, the 15th mobile hospitals? I believe that going back from here, I finished this press conference saying that that is not just the instrument to improve life, to save lives, but to my understanding, that's the instrument of reforming the healthcare sector. We need to show that this is the correct Western standard and that it is possible in Ukraine, in this legislation, in this climate, in this country. Now we concentrate on getting this hospital up to the world standards so that the ministries cannot say it's impossible. When we prove in practice that this is possible, then we believe that would become an engine that would pull the whole military medicine and the whole medical sector, which requires radical changes. When will be the next trip to ATO zone? We now feel the needs. We prepare the mobile dental office, and in the second half of January, we will not tell the exact date, but we'll move there. Any questions? Then a small announcement. When we were leaving, you were seeing us off, and we believe that the doctors who left their homes, who left their workplaces, they deserve a very warm meeting when they arrive to Maidan. You see our reanimation mobile hospital. They will come and they will arrive to Maidan. Please come to Maidan at 5 p.m. today. You will talk to people who were there, and you will see how our equipment survived this trip to the front line. We wish you to reform the medicine, and we wish you to have fewer